Data is king, and that's what we've been told for a long time. Science without data isn't science. And for the last few years, we've seen evidence that science has let us down because science hasn't been practiced the way it's meant to be, critically and without censorship. Today, we're about changing some of that. We're going to bring some data to the fore. We're going to have that data looked at, and we're going to discuss these situations. Welcome to Club Grubbery. My name's Graham Hood. And today is Wednesday, the 23rd of July, as we record. Johnny Larder, great to have you back on, mate.
Thanks, Hoodie. Yeah, great to be back. And this is going to be an enlightening program. That's for sure. The last 24 hours with RFK banning the use of the mRNA vaccines for pregnant women and children, I think speaks volumes for data.
It certainly does. And we're going to be looking at quite a little bit of data today. And to help us do that, we have a researcher who is known as the TGA Whisperer from Wollongong on the Illawarra coast of New South Wales, Sharon Cousins. Great to have you on, Sharon.
Hi, Graham. Hi, John. Welcome.
And we also have our friend, Dr. Philip Altman, who's been a guest on this program, has done several Altman reports and has worked extensively for almost half a century in looking at regulatory policies around vaccine and vaccine rollouts and research, and has worked extensively alongside the TGA for some 40 years. Philip Altman, great to have you on.
Thanks for having me back, guys.
Okay, so we're talking about data, and there's going to be quite a bit of it presented. I want to read something first of all that John just sent me. It's a piece of scripture that relates very much to what's going on. And this was put out on a post relating to RFK's efforts in firing all 17 members of the CDC's vaccine advisory panel. And the reference is Luke chapter 12 and verse 2. And it says, "Nothing is hidden that will not be disclosed, or concealed that will not be made known." And that's what we're after. That's what we pray for. We pray for the light of truth, that we can all revel in that light and come to terms with the issues that we've been confronting in the last few years. So, Sharon Cousins, you're going to present some data to us. We want to hand the floor over to you largely, and Philip Altman will give his expert analysis of some of the stuff you're presenting, which is quite frightening, to be honest with you. And what's frightening, Johnny Larder, is that this material is right in the face of all those people in charge of our regulatory agencies, all the way from APRA through to the TGA, ATAGI, and yet there seems to be no action taken on this data.
Yeah, I mean it's ridiculous, and not only is there no action, Hoodie, but we're still seeing this complete failure of governments to bring people back into essential services because of mandates. So none of it makes any sense. But anyway, we'll explore the data and hopefully open up a few more cracks in the damn wall.
Absolutely. And Philip Altman with not the TGA, with the Australian government, and Mark Butler pallying up with the WHO and putting our signature to the IHR without our consent, I might add. This data and this analysis is really critical. Wouldn't you agree?
It is very critical, very critical. I've seen what Sharon will be presenting, and it is of great importance to everyone in Australia and the world.
Okay, well, Sharon, on behalf of everybody who's watching this, we want to thank you for the tireless efforts that you put in. We know you do it as a volunteer. You've had to look at some very damaging data, and you've also walked alongside some of the vaccine injured as you explore options and avenues for them. So, Sharon, we want to hand the floor over to you. You've got a screen share there available to you. So we're looking forward to seeing what you've got to present.
That's right. Thank you, everyone. And thank you for everyone watching this. And please share it. If you can, at certain points, you might want to time mark it and screenshot the information because we will go through various websites and information. Just to preempt this data represents people, families, individuals, children that weren't born following the jabs. And so I'm going to try and be clinical, but I'll try not to be too emotional as well, because I do know a number of people who have died following the jabs. And the developer of one website called Open Dane, now in case Google doesn't translate it properly, like a dog, Open Dane, like Great Dane, it's opendane.info. Dane is database of adverse event notifications.info. It's a free website that we've put together, and it assists the published data of the 141,000 plus cases, including the 1,050 deaths reported following the jabs from December 2020 until July 25. So I'll go on to the TGA DAN and I'll guide you through, and then we'll pause intermittently for questions and comments. Is that okay?
Far away.
Okay. Okay, so this is the TGA.gov.au. TGA is the Therapeutic Goods Administration. It's part of the Department of Health, Disability and Aging. So just scroll all the way down. I'm going to go really fast to make it quicker. Click on that one, the medicines. And this covers 54 years of data of thousands of medications, including, the childhood vaccines, Panadols, COVID jabs. So this is from 1971. Obviously, the jabs didn't start until February 21, but I will show you it actually started the 21st of December 2020, and I'll show you why. And the TGA works 2 weeks behind. So even though we are looking at the 23rd of July today when we're recording, they do 2 weeks behind. So quickly do COVID and press the search engine, and all the jabs will come up. Commonality is Pfizer. And then if you scroll down, TNS, people didn't know some of the jabs that they got. AstraZeneca, Novaxovid, Novavax, Spikevax is the Moderna, okay? So as you can see, as of today, 141,541 cases have been reported, of which these are the medicines. They're just obviously all the cases, and some people got more than one jab. I know from one report there's of a death of a woman, and she's had 6 jabs, but some people have only had 1 or 2. Now, out of the 141,541 cases in Australia, that includes 1,050 reported deaths, of which 9 are children aged 5 to 17. I know the identity of the first child, a 17-year-old boy. Okay, so this is the most recent case, 844865, 9th of July, 19-year-old female. Commonality is Pfizer. Dr. Philip Altman, can you pronounce what that medical term is? Is it erythema?
You're on mute, Philip.
Erythema multiforme.
Okay, do you want to explain to our viewers what that is?
It's general redness. Erythema means redness of the skin, but
it's like a rash.
Yes, yeah.
Okay, so just to show people visually, it's a skin reaction to stresses, illness, infection, or medication. It looks like a bullseye or a target. It's very red, itchy, and painful. And it says here that it could be from causes including certain vaccines such as the COVID-19. Okay? And this particular woman, that's the Pfizer. She was only 19. Now, just a trick or tip, you can find the very first one by clicking this arrow. It does take a while. Oh, there you go. Now, we know that the jab started in February 21. So why is this case, the 21st of December 2020, 46-year-old female, Pfizer, and she's got a whole pile, and we know that is a death. And how do we know that? because a very good volunteer gentleman in Victoria started collating all the deaths every week to find out where they were. And you can see it doesn't say death on here, but deaths are here on the numbers. It's very hard to find, but he manually did record them, okay? And that's why we have the opendane.info, because we can match the deaths with the cases and the dates now.
So this is a recognised vaccine death.
Reported death.
Reported death.
Yeah.
Recognised as a COVID-19 injury.
Yeah. So we believe...
It is amazing that the word death does not appear in that record.
So we believe, okay, she got this overseas. And I looked at which was the first country that started jabbing with the Pfizer, and it was UK, Europe, USA. And someone said to me, this could actually have been a participant, and she died, okay? Now, the media never picked her up. We know in January 2021, in Norway, we had 20-odd elderly people who died, and that was reported, and that went viral, okay, following the Pfizer. But this unknown woman was never picked up. And I do know the very first death of a male, and he was the reported in February of 21. But whoever reported this 92-year-old male's death reported it on VAERS, and I have his report. VAERS is the American Vaccine Adverse Event Reporting System. And this is, I'll show you his picture. Okay. 10725601. That is a VAERS report. Foreign is Australia. He was vaccinated on the 26th of February 21, and he died 2 days later, the 28th of February 21. And it states he was not in hospital, death, and it says Pfizer, and there is the batch number. EP2163 serial 1. What does that mean? The very first batch in Australia, okay? That was released on the 9th of February. How do I know that? Because of the TGA's batch release assessment. All of that information was documented by some very good doctor, okay? And it was reported on the 4th of March. See that? 4th of March, 2021, but he died on the 28th. But this doctor, whoever it was, reported it on the TGA's one a few days early on the 1st of March. And it says that he was, I'll just briefly say this guy was well, but he had allergies and he had Voltaren, he had dementia, but they said, they followed the dementia protocol. It names where he was at a nursing home with Healthcare Australia, okay, and it was not reported if an autopsy was reported, but the patient died, okay? Now, people, this is very important. He had allergies, okay? Now, I'm going to take you now, Dr. Altman, I'm going to take everyone to the EMA report, okay? Not many people around the world know about this, apart from the TGA, ATAGI, many medical people, but not the general doctors or pharmacists. The European Medicines Agency is the equivalent of the TGA, but much higher, okay? They did an assessment report on the 19th of February 21, and see that word? Corrected. So they changed it. And I know the original one was December 2020. Assessment report, and what's the common how do you pronounce that? Community?
Community.
Okay. Okay, that's the Pfizer. All right, I'm going to show you this page first, 115. I've highlighted in yellow. Summary of safety concerns. This did not go to the general public, okay? Top one, anaphylaxis. I read the 140-page document and found out that Pfizer did not include any study participants who had a reaction to past vaccines, or more importantly, a reaction to the components of the Pfizer. How convenient to just eliminate a whole stack of people who could have anaphylaxis. Now, we know from Channel 7's report on COVID last year, 30th of June, 2024, Dr. Karen Phelps's wife, Jackie Stringer Phelps, she had an anaphylactic reaction, but they knew anaphylaxis was a known, identified risk. And so she got jabbed in hospital. She had a reaction almost instantaneously, okay? And that's all documented. It's public knowledge. What's the next one? Vaccine adverse enhanced disease, respiratory, missing information. So what does that mean? No data. No data on women who were pregnant or were breastfeeding. Why is that? Because the very first trial study of the Pfizer did not include pregnant or breastfeeding women. Again, this was not made public. It was all, get your jab, you'll be safe, don't worry about the pregnancy. It's more of a risk if you get COVID virus. I've had COVID. I've had cancer as well, breast cancer. And I went to a local chemist after all the clots of the AstraZeneca were made public in 2021. People were queuing up. The phone was off the hook. And they asked me, do you want to be jabbed? I said, I want to see the consent form. I want to see the adverse reports. I want to see what the reactions are. And I knew from studying this, I knew people had already died. And I went through, and in a very loud voice, in front of all the patients waiting to be jabbed up at the chemist, I said, you're missing one. And they said, excuse me? I said, on this government informed consent that you have to sign away, you're missing death. And I walked out of that pharmacy. Immunocompromise, use in frail patients. That's our elderly. Why? Because in this study of 44,000 people, of which half were placebos, okay, salines or whatever, they only had a minute number of 85 and over elderly people. And as you know, the jabs started with the elderly. They were locked into their aged care centres and they were jabbed, okay? And we know this was an experiment. Why? Because Greg Hunt told us so, the previous health minister. And what happened to Greg Hunt? Who may recall, in March 2021, Greg publicly on the 7th of March got the AstraZeneca. 2 days later, he was taken to hospital in Sydney. Oh, nothing to do with the jab, just a coincidence. Bacterial infection. He was so sick, he was intravenously given antibiotics, transferred to a private hospital for 4 days in hospital receiving antibiotics, and they said, oh, he's been diagnosed with cellulitis. What is cellulitis? Bacterial infection. I'm going to show you the OpenDane now. OpenDane.info. This is another database, but it's the same. You can see our website, which is here, OpenDane.info. Okay, but this is a quicker one. So I'm going to show you quickly, if I go down to the reaction, and if I put in bacterial infection, there it is. This is all from the TGA. 36 people, of which 6 were serious. Oh, good, no deaths, okay? But there was already a death in the UK following the AstraZeneca. Now let's change this to the cellulitis, okay?
Which is the same thing as bacterial infection.
Thanks. 295 cases, of which 65 were included with serious. There were 3 deaths. Now let's just find when the deaths occurred. So we just press death. This red one is AstraZeneca. The blue is the Pfizer. They occurred August 21, after Greg Hunt was vaccinated in March, publicly on a Sunday. the 7th of March, and he's in hospital 2 days later. These deaths occurred in August 21, November 21, and July 22. And they were 2 males and a female. We'll go down. And these are all on the TGA DAN. How do we know that? Because we update this weekly. We manually update from the TGA website. How do we do that? We'll go on to the TGA. And on the right-hand side, you can click cellulitis. Now, there's going to be hundreds here, but it doesn't tell you. I can't spell cellulitis. Cellulitis. How do you spell cellulitis? There you go. Yep. There you go. See how exact our opendane.info is? We only know the 3 deaths, but you have to go manually to all 295 to find out was one with a cardiac arrest, okay? But no, because we are weekly going through and updating, and any deaths, we update them on the DAN and we update the reports, okay? So why didn't anyone say, don't you think, Greg Hunt, this was causal proximity, not a coincidence? Because after everyone started getting jabbed, 300 people were injured, reported, and they're just the ones reported. Philip, would you like to talk about the underreporting factor? Do we want to make a pause here?
Yeah, let's do that.
Okay.
Yeah, Philip, the researchers around the world and many doctors who've been speaking out have been talking about the difficulty of lodging a report, and underreporting is rife. Some of the statistics around underreporting, I think the worst one I heard was it could be 100 times more. You got any data on that?
Sure. So taking a 30,000-foot view of all this, you have to step back and first of all understand that the people who are controlling the adverse drug reaction reporting systems and assessing the individual reports that come in for causality to the COVID-19 vaccines, these people have been lying to us consistently for 5 years. They've been lying about absolutely everything, from the origin of the virus to saying it was safe and efficacious, to claiming the vaccine would keep us out of hospital. They lied about the efficacy of masking, social distancing, lockdowns, the injection staying at the site of injection, the DNA contamination, the millions of lives saved. All these were lies. Now, the same people that have told you all these lies for all these years are now in charge of assessing the post-marketing safety of these vaccines. Now, to begin with, I don't trust them. I don't think anyone trusts them to provide a accurate assessment of causality. That's the first thing. The second thing is there is something called an underreporting factor, which is recognized throughout the world. Our TGA, every regulatory agency is the same. They all recognize the underreporting factor. How they differ and how individuals who have published on this matter differ is the extent of the underreporting. The TGA have claimed in the past that only about 10% or 5% of the adverse drug reactions are reported. So keep that in mind. They themselves say 5 to 10%. However, most agencies throughout the world and most independent researchers would say the underreporting is closer to just about 1% or 2%. That is, only 1% or 2% of the serious adverse events are actually reported. So when the TGA, our TGA, says that there are 1,050 reported deaths associated with the COVID-19 vaccines, you can multiply that figure by between 50 and 100. So it could be 100,000 people have been reported to have died in association with the vaccine. It doesn't mean that every one of them have died because of the vaccine, but every death should be investigated.
Mm-hmm.
And if you look at some of my Substacks, including a recent one of the 10th of July on my Substack, I refer to 35 cases of death which have occurred the same day that they were vaccinated for COVID. 35. And according to Freedom of Information requested by Rebecca Barnett, who's doing a fantastic job in this area, none of those 35 have been followed up through the usual vaccine safety investigation unit to determine causality of death. And it looks like none of those 35 are included in the 14 claimed deaths that the TGA say have died because of the vaccine. There could be thousands, many tens of thousands of people. So that's the problem that we're facing, that if you give the TGA sole responsibility for assessing causality, and you don't know who's assessing causality, you don't know what criteria they're using to assess causality, and they don't even follow up deaths, how can you rely on their numbers? What Sharon is reporting is just the tip of the iceberg. You can multiply the damage that she is revealing by 50 to 100 times. And this is what we're facing. And this is why I believe the whole system of assessing adverse drug reaction reporting has to be taken out of the hands of the people who have approved these drugs and put in independent hands, people who are unbiased, who are experienced, and who will tell you how they're assessing, what percent of follow-up cases they're chasing, and so forth. In my day, a single case of death with a drug would have been diligently followed up by the TGA. They would have made phone calls, they would have sent people for interviews and so forth. All that is over now.
I can concur, because I helped a woman who lost her mother to the jabs and spent hours reporting it on the TGA. You can self-report, or you get a nurse to do it, or a doctor to do it, a consultant, or a family member. And so we got the report. They emailed the daughter saying, condolences, but thank you for your experience of lodging the death, and we listed over 30 reactions alphabetically to help them. Not one follow-up phone call, not one further email investigating it, because it was a coronial investigation in Queensland. And that case is on the class action with Dr. Melissa McCann amongst hundreds of other people. So I can concur what you're saying. The TGA did not investigate.
Yeah,
They rely on the autopsy. And we know with the autopsies, they didn't test for the spike protein or the viral nucleic acid. This particular autopsy in May 23, we requested, the family member requested, and under the Coroners Act in Queensland, I think it's 2003, you have a right to request certain things to be tested, and they denied it. They did not pursue it. And we know that in Australia, there's no, well, possibly one, forensic pathologist doing this protocol. And I've got the protocol listed on our website as a resource. They're going to Germany to get done because the specimens are being taken over there to test to see if they were following the jabs.
All this would come out in a royal commission, right? And that is why they don't want a royal commission. Because questions would be asked. For example, with these 35 people that died on the same day they were vaccinated, questions would be asked. Why didn't you follow these patients up? And
that's under an FOI.
That
that's under an FOI to the TGA. That's day zero. Yeah,
you'll be providing links to people to go and look at this these websites providing the data specifically on the underreporting, and we'll post those in the description.
Thank you,
John. Any comments?
Well, look, only to say, Hoodie, just in relation to the underreporting, I mean, we've got to understand too that the majority of the health staff that are involved in this at hospitals and those sort of facilities that are picking this up have been conditioned not to report this or not to even recognise that it is a vaccine injury. So, I mean, we've got AHPRA sending them letters saying that they're not to go against the narrative. So, I mean, they're not going to be looking out for this vaccine injury in their workplace. They've been conditioned against it. And the other interesting thing too is that Jared Rennick, I think, has repeated on numerous occasions that the majority of these reports of deaths and injuries have been reported by medical professionals to the TGA. Now, that's what's laughable about this, that the TGA thinks they know better than the treating doctor. I mean, it's laughable, really. And I'll go back to that. There's so much stuff to actually look at here. I mean, like Philip said, the only way you'd get to the bottom of this is to put resources at it at a Royal Commission. I mean, that first one that Sharon indicated died, I think, of erythema multiforme. I mean,
oh, they didn't die. It was just the latest case.
Latest case. Well,
yeah.
I mean, look, at the end of the day, that indicates that somebody's got a rash. But I mean, that could have been as a result of anaphylaxis. So, I mean, that is a result. That is a side effect of anaphylaxis, redness, urticaria, rash, etc. So, I mean, we can't rule out that person had an anaphylactic reaction, and that hasn't been reported properly.
And there are deaths on the TGA DAN following rashes, puritis rash. There's hundreds of cases. All right, just to let you know, I did research studies on the reporting factor. What is it? I found the FDA, a 2011 report, said it was 1%, but I found an Australian report said it was 6%, and that was in 2023. So I found the link, and it's a government, website, according to it's the Australian Pharmaceutical Society of Australia. Anyway, interesting enough, 6% is you multiply the figure, say it's 1,050 deaths, you multiply that by 16.6666 whatever, that's 6%. So that 1,050 deaths following the jabs in Australia, the COVID jabs, represents minimum 17,500 deaths, okay? Just the 6%. And then you can do the 1%, and it's over 100,000. Okay, so I'm now going to show you, we're going to go deep now. It's going to get a little bit, just prepare yourselves, because we're going to go into the child deaths and the batch numbers and the really bad batch numbers. Okay. Okay. As you know, the TGA doesn't show on their database death, but because of the good works of volunteers who have been daily, weekly, over 3.5 years tabulating the deaths, these are all the case numbers of the 9 children. These are the report dates, the ages. So we've got 5-year-olds to 17-year-olds, and we have 5 males, 5 boys, and 4 girls. And the batch numbers, how do we know the batch numbers? Because of FOIs. People have asked the TGA for the batch numbers, and if they're reported, because there's another system which people don't know of, but the TGA has, which is called the AEMS, which is the Adverse Events Management System. And they have the vaccination date, they have the vaccination provider, they have the death date, or the reaction death date, obviously the reporting date. It could be the same day. As we know, 35 deaths were reported on day 0 on the TGA. Now, I'm going to tell you this one here, this 17-year-old boy, okay? I know his identity through a family member, and I know the death date was a couple of days beforehand. So, and the autopsy was done, and this is the batch number, FF0884. This is the dose number. So he only had 1 dose, and he died literally within a fortnight later. And commonality is Pfizer, headache, malaise, viral myocarditis. And yes, and these are the FOIs. The FOIs have now been updated. I've done 5293. Now look down here. People, these are children. These are grandchildren. And we don't know their names. I only know this child's name. But this 5 and 10-year-old boy, they had the same batch number, FP1430. And I asked the TGA when I went to them for the batch numbers, why was there a child's death taken away, which is in Dr. Altman's first report, a time of COVID. And they said, normally we wouldn't answer your query, but one of the deaths was a hoax because they investigated it. So they did do some, okay, because they couldn't find the identity, but these are all children, 9 children, and there are over 5,000 children reported with injuries, including those who got rashes from mothers who were breastfeeding and got jabbed. Now, this 5-year-old boy died after dose 1 of the Pfizer FP1430, and this 10-year-old boy got the 2nd dose, but that was the batch number. That's how potent it was, okay? And we don't know the batch numbers of the others, except this one, which is the Spikevax, which is a Moderna, a 14-year-old girl, October 21, brain injury, cardiac encephalitis. And the very last child was a 17-year-old girl. Look at that Christmas of 2022. How would the families and the friends be with that? And it was a heart issue. Okay, I'm going to show you this extremely bad batch number for children. Going into the opendane.info, and I'll just refresh it. Now, because people type in wrong batch numbers and wrong letters, this is a tip. When you go on to the opendane.info, DANE is DAEN, Database of Adverse Event Notifications, do not write FP1430 because F sounds like S for Sharon, S for sugar. So this is a tip. We always say, take the letters off, then do the search. And can you see it's all Pfizer there? And 1 Novavax, because people got more than 1 jab. And what you do here, you batch number select, click that, and you'll see that one is a Novavax. So we want that one taken out. So we click that one, See, FB sounds like FP. If we don't number these, you'll get the wrong results. So, sorry, it's a bit. Can you see the numbers are changing on there? So we know that bad batch of children, there are 903 cases, and those, I'm going to cry. Those are the 2 boys that died within the 913. Why is it a bad batch? Because look at the date it started. January 22. They started on the children aged 5 to 11 on the 10th of January 22. And look where they were all injured, all reported. And the May was where the 2 boys were reported deaths. Let's go down to all the cases. Chest pain, fever, pyrexia, rash, okay? And then you have the 900 cases. Look at the first one. Within 1 day of this being released into Australia, the children started having been reported, okay? Now, this is a mild case, okay? But it just shows that people were reporting these things, okay? Including the deaths. And there are 44 serious cases. And what you can do with this search engine, which is brilliantly been done by a gentleman who lost his own brother to the AstraZeneca, a 30-year-old. He was found dead by his father in their home on their mother's birthday. And you can go serious and eliminate the 900 down to the 44 cases of serious, which includes the 2 deaths. And you can see, look at the ages of the children, because they started jabbing them at the age of 5 onwards. Multi-system inflammatory. Look at this. See, it says SARS test positive. So this child got COVID even though they got jabbed. Mm-hmm. And we know that is the main one that's been told. So I'm going to refresh this. I'm going to now, just prepare yourselves. I'm going to show you the very worst batch number released in Australia. It's another Pfizer. There's so many. There's 440 batch numbers.
Now, we're talking about kids who have died or suffered severe injury as a result of these vaccines when they had virtually zero chance of being affected by COVID if they caught it.
Correct.
Absolutely unnecessary to vaccinate children.
I got COVID myself in March 22 I'm a part-time nanny, and it was a 5-year-old girl that got it. She was fine. I was laid up for 3 days with muscular back pain, and then it was a bad cold. I was, couldn't eat, fatigue. So 7449, it's actually ER 7449. And we'll just double check, see how people reported it differently when they entered it. This one didn't report it with the ER. And EK, ET, these are all the same batch, but typed in incorrectly. See, GR, SR. So we know all of them are 7449. So we select all. Look at this, 3,800. So if we multiply that, 3835 times, let's do 6%, which is 16.6666. That's 64,000 just with this batch number, of which 43 include deaths, and 43 are within this 3,000. And let's look at when it started. Actually, we can go up to the top here. There you go, 21, March 21, April 21. That's when people were being jabbed a lot after the AstraZeneca. They were waiting for the Pfizer. Yeah, 43 people died. And if we go to the deaths, we can find out from here, there was more women than men that died, 24 women, 19 males. And these are the reactions. And this is the reporting date, 90-year-old. Do you remember they started with the elderly?
Yep.
And this is my batch number, not my batch number. I paid for that, FOI 5293, and I will update this on the 31st of August, 31st of July. I will go back to the TGA and I will say, can I please have an update on the batch numbers? Because that FOI finished in August, I think August 24. So we have a whole year where we don't know the batch numbers for the cases. We just have the cases. Okay. So, there, youngest is 60. All right. Now I'm going to show you one more batch number. Just refresh it. Do you remember I told you about that 92-year-old male? He was the very first male reported death. And he was jabbed on the 26th of February and he died on the 28th. Do you remember? The VAERS report showed EP2163. This was another bad batch. I'll go down just to make sure there's no errors or other jabs. They're all the same batch. So we press all. 681 cases, of which 10 were deaths. And look, February, March 21, April, because the elderly were being jabbed first. The very first case after that 46-year-old woman who died was reported in December 2020. This was the very first case for this batch number, 22nd of February. All right. And then further down, you have to go all the way to the 1st of March to find this 91-year-old. There he is, 92-year-old male. So 520837. Whoever reported him on the VAERS, and he died at a nursing home. And he had an allergy. So he probably had an anaphylactic reaction. And no one was told. But Dr. Karen Phelps knew, and her wife knew. That's why her wife Jackie got jabbed in a hospital and she was injured. Okay, because they knew anaphylaxis was a reaction. All right, I'm going to do one more important thing, is to show you on our website, opendane.info, resources. These are other links, and out of the 30-odd links, these are my top 10. If you have been vaccine injured from the COVID jab, or you know someone in your family or friends, there is a class action with Dr. Melissa McCann. Number 5, if you want more evidence of jab injury stories, go to Jab Injuries Australia, and they have a web page that I wrote on how to find your batch number. It's a free resource. It's the most widely viewed page, as well as the testimonies, including a woman called Lara who lost her son at 12 weeks pregnancy. They named him Ollie. 2 jabs of the Pfizer, but she was told there was no risk. And she's done a 1.5-minute video, and I've listed it here. The autopsy protocol. If you're a forensic pathologist or you are in New South Wales pathology, Victoria pathology, anything to do with government, you need to look at this autopsy protocol developed by German pathologist Arne Burke, who died at the age of 79 in May 23, but he released it, okay? And we used that for the Queensland Coronial, and they denied it. They said, we're not doing it. Okay, that is very important. 25, 20, 24, 25, 26. That EMA report that I showed you on the Pfizer, there it is. And the key pages, I forgot to show you. page on the Pfizer 55, it says no genotoxicity nor carcinogenicity studies. I went to my doctor in 2021 knowing that I had breast cancer twice. I said, I want an exemption. She said, you can't have one. I said, do you realize this report says it wasn't tested for carcinogenicity, which is cancer causing, and DNA genotoxicity is DNA damage? And she said, you don't have a contraindication. I said, I don't know what that means, but I ain't taking the risk. Okay. And this one is the Moderna report. They are absolutely vital information because it deals with the lack of informed consent, because they have summary of safety concerns. Okay. This was public information listed on the websites, but they were not made public to the Australian public, to the global public. Okay. Next one down is a key one, is number 29. This is on Cafe Lockdown. It is an explosive interview with a vaccinator, as in a nurse, and it's only 25 minutes. And she said on one weekend they were just pumping out vaccines, and the doctor was really sort of, oh, I better make a lot of money with this. On Monday morning, he was beaming because of the thousands of dollars he had made that weekend. Okay, so that's a very, very important one. There is the 1.5 minute video. I won't go. I'm telling you, people, it is very distressing. It's done to music, and it shows the woman, Lara from Queensland, and what she went through, and she put it together. Okay, it's on X. The next one down is vaccine carnage. It is a nurse in Queensland who is ED, and she gives testimony of what she saw in hospital. She was injured herself, and then when she didn't take the second jab, they terminated her. That is a key testimonial video. Okay. Then you got the Port Hedland one, which is great, with the councils, the DNA contamination. And
so we'll put the links to all of those in the description.
Yeah.
Sharon, so people can go through those.
Yeah. Can I just do the last one here? This number 36 is a video testimonial in Canada of a funeral embalmer called Laura Jeffrey. And she said people will still come in with Band-Aids on their shoulders. Okay. She said they weren't doing autopsies, which she said, quote, is an anomaly. And she said the number of deaths of babies as well. And she also gives visual aid of the clots that they pulled out of the carotid artery, which is in the neck. I sent those photos in a submission to government for the increased deaths following the jabs. And I said, please make my 12-page submission public. They refused. So I rang the Australian government parliamentary office, and I said, why didn't you make my 12-page submission compared to AMPS's 700-page one? And they said, because of the graphic images. I had to go back to my report, and what graphic images? They were the 3 images taken from the bodies of Canadians following the jabs, and they deemed it, the Australian committee on the submission, they deemed it as being too graphic to show people. So people, fast forward, I'll give you a tip, fast forward to 18 to 23 minutes, and you can see the graphic images of the clots taken from the jabbed people. All right. Do you want to pause it there?
I think, John, you raised earlier before recording the incidents happening at Bulli Hospital.
Yeah. Yeah, well, I think that needs some clarification. There's a lot of rumour going around about 18 staff members that have been hit with cancer mysteriously. And Ryan Park, the Minister for Health in New South Wales, seems to be pretty silent on this. But I would have thought that if there is 18 people that have come down with cancer that are staff members at the one hospital, because it is a small hospital, that should be a matter of interest to the public.
I actually know. I have the entire list of the 18 staff members. mostly nurses, out of the 18 cancer cluster. These are all post-COVID jabs. 9 have breast cancer. 3 are nurses known to me personally, and they are on the Dr. Melissa McCann's COVID class action. And one nurse, she was a senior nurse, she actually got a genetic blood testing because there was no one in her family that had breast cancer. And like we're talking generations. And it came back, oh, yours is just a sporadic case. Now, she gave me her batch number. And the other nurse gave me their batch, or all 3 of them. The other people, some of them have given their batch numbers, but not all 18. I'm talking breast cancer, lung cancer, brain cancer. One's died of pancreatic cancer. And the 2 nurses that gave me their batch, well, 3 have breast cancer, 2 were of the same batch number, which is FN 0565. Now, I'm going to show you something significant about this. I'll just do a screen share as evidence. Screen share. Okay. Dr. David Speecher, he's a Canadian virologist. He was sent 3 Australian vials. He wrote an 11-page report dated the 7th of September 24. This is the executive summary. It was sent to him from Miss Ashby Coppins, who's a lawyer in Australia. She's actually a New Zealander, but she's in Australia. These 3 vials, as in VIALS, were Pfizer. Can you see? FN 0565. Those were the same 2 batch numbers, same batch number of the 2 nurses. And I looked at their jab dates. They were different dates. Now, come across here. He did run 1, run 2. Look at the DNA levels, 494, 848. It's supposed to be under 10 according to the TGA limit. That is an excessive amount of DNA contamination. And both of those, we're seeing turbo cancers. If you go into the OpenDaen, daen.info, and click the organ system called neoplasms, and that is cancers, malignant stuff. And you've got there's over 400 cases of cancer just reported following the jabs, and those 2 nurses are listed on it with their batch numbers. So how to break that? Okay, nurses, we needed you in COVID, and you were our heroes, but now you're going to have to be jabbed, and now you've got breast cancer because their employer forced them to. Otherwise, they would have been terminated.
Dr. Philip Altman, I mean, this is a critical moment in this whole development, I think, particularly because this now relates to a New South Wales hospital, 18 staff. I mean, on that information presented there, if that's correct, what's your assessment of that? 50 years working in this space. I mean, it's unheard of, isn't it?
Well, the evidence is quite damning. This business of the problem with certain batches has been recognized for more than a couple years now. Widely published. There are papers in the literature that show that there are concentrations of death and serious adverse events related to certain batches. A lot of people were lucky. They got batches that didn't have the claimed content of the active ingredients in the vaccine. These COVID vaccines were the most complicated pharmaceutical formulation I've ever seen. And they were developed in a rush. And the normal quality control that was required to establish the safety limits for these vaccines was not done. The scale-up manufactured safety tests were not done. They even changed the formulation of the vaccines after they did the initial trials with a few hundred patients. it was amazing. It was a number of errors and misjudgments and lack of care, lack of quality control, which has contributed to this problem. One of the best surveys ever done was in Denmark, and it showed that 71% of the serious adverse events that were reported in that country in 52 batches were responsible for which occurred in 4% of batches. So it shows you graphically the concentration of serious adverse events and death related to certain batches. This is widely recognized. What Sharon is talking about has been known for some time, and the government has done absolutely nothing about it. In fact, I believe they are covering up as best they can. There's been expert reports and communications by world experts like Kevin McKernan, who have written the TGA, published podcasts, who have said the way you're assaying for the DNA contamination is wrong. It underestimates the contamination, and they've taken no notice. What people don't recognize is that the TGA aren't experts at anything, in actual fact. They rely very heavily on international and local experts in various fields. They can't keep up with everything. And yet, in this particular case, they're taking no notice of world experts who've told them that what they're doing is wrong. They've taken no notice whatsoever.
And I asked Philip in October 23 in Parliament, when there was the AMPS conference on excess mortality, with that European Medicines Agency report, which was dated, February 21, and the summary of safety concerns, anaphylaxis, missing information on pregnancy and pregnant women, because they didn't test them in the first trial. Why did the TGA still permit these drugs to be given out massively? Because of the scare campaign. And then Philip said to me in front of all these people in the parliamentary room, because the TGA placed it as provisional status, it was under a trial, and therefore it got the back door in for acceptance because it was a trial and they used the words provisional, okay? And in the European Parliament, there was a UK Pfizer executive, and she was asked, did you know that the vaccines didn't prevent transmission? And she said, yes, because we were working at the speed of science. I said, well, why don't you work at the speed of safety? Yeah. And thousands of people have died. We've had over 300 miscarriages, stillbirths, fetal deaths, menstrual issues, cancers, heart issues, deaths, including children, and deaths in the wombs. And they didn't tell people. So this is like informed consent gone bad because of this provisional status.
And these 18 people, Dr. Philip Altman, that are affected by cancer of bull eye, I mean, this just really backs up the data that was released by Barry Young in New Zealand, doesn't it?
Yes.
We saw what happened with him.
Okay, so the government, if they really wanted to know the truth, it's easy to find. All they have to do is go through the records since 2020 of the people who have been dying,
Excuse me,
and whether or not they've been vaccinated or not. And they refuse to do it. It's easy to do. They're even trying to bury in Queensland data on more than 10,000 patients that could give you the answer right now. And they're trying to destroy the biological specimens and all the data. Because I suspect they know what the data will show.
And there was a 19-year-old that was reported a death in March 25. A 19-year-old girl. Oh, she's not a child. She's a child of someone, and it's got viral myocarditis. Why are people and children and adults still getting the jabs? March 25, another death. And I'm going to show you the last thing is the DNA contamination, where we have found, or I've found, and I've put it in a video, and I'm going to make the video as of the time this is published public. At the moment, it's privately listed. It is a discovery about the wrong of what the TGA publicly said when they tested their batches to say there's no DNA contamination. I'm going to show you this, and then that will be the end, okay?
Yep.
I think highlighting that 19-year-old is significant because that 19-year-old died in March 2025. Now, even by the current standards adopted, anyone under 18 is not recommended to have it. So that person still would have technically, per the government's endorsement of these things, qualify for a vaccine.
Yep, and I've got a young person, an 8-year-old girl, and it says in July 25, administration error due to inappropriate age, because they stopped it for under 8. They should have stopped it, period. So I'm going to show you this website. It's the TGA batch release assessment for COVID vaccines. They give you all the batch numbers that they've released over the last 4.5 years. And it's a bit strangely dated. So let's just go and I'll show you. This is the very first one, EP2163. There's 440 batches. And there you are. That was the 92-year-old one who died, the male. It was released on the 9th of February, 21. And he got jabbed on the 26th of February, and he was found dead 2 days later. Can you see it says passed for composition, purity passed, integrity passed, endotoxin identity, yeah? Now, watch this. FC 3558. There are 2 batch numbers exactly the same. Pfizer, one is released on the 13th of May. And what's the asterisk mean? They used to have it. It said from overseas, but they've taken off what the asterisk is, but they've still left it in. See, it says passed, not applicable on remarks. But look what's happened here. In June, 1 month later, not tested. I'll make it bigger. Not tested, not tested, see remarks, not tested, see remarks. Well, what are their remarks? Reviewed, limited batch quality allocated for use by Pfizer staff. Ooh. Now, watch this. FF 0884. Again, the same batch number released at 2 different dates. Pass, not applicable. That one was given to the 17-year-old boy who died within 2 weeks. He was jabbed in August. But what happens up here? In August, not tested. Oh, another batch going to Pfizer staff. That's peculiar. Okay. The TGA in November 24 makes a resounding summary statement, public statement saying there are no DNA contamination because we have tested our batches. Well, I'm the TGA Whisperer and the batch queen, as they call me. I'm going to check. I had to manually check. So they do their summary, and they've said here, endotoxin, every batch was released, was tested. Every batch? Let's have a look. You've said you've done a sample of 28 batches. Let's go to the 28 batches. And what were they? There they are. Spike facts. So they tested 28. Look at the dates. 23. All the deaths were mainly in 21 and 22. So they've selectively used batch numbers later on, okay, and 15 Pfizer. So they've got 13 Moderna, which is your spike vax, 13 and 15 make 28. So I manually went into the batch release assessment to find out when they were released, and I'm going to check. Did you do tested, or not tested? So I put all 28 into the open DAME and the batch release, and I put it on an Excel. Pfizer, 15 batches. Moderna, 13 batches. What does the blue mean? There were no TGA cases. See that? That's the batch number, 00042. Okay, and no cases. The pink means not tested. You've got to be joking. They've said they did test them. So we're going to have a look at 36 and 37. And I've done a video of it. And blow me down, 2 of the batches have got deaths in them. Oh, we've tested them. They're no DNA, but we do have some deaths in there. So let's go into 36 and 37, just to show you as evidence. Did they test them? So we'll go back into the batch release. That's the FOI that I did, 5293. Now watch this. What was the number? 0000036. Spikevax. Not tested. Not tested. Not tested. Not tested. Oh, why? Because we're waiting for another shipment. Well, if there was another shipment, why wasn't this disclosed? Because they're saying 36 was in the clear. No, it wasn't. Let's go to 37.
Gee, Philip Altman, you must be tearing your hair out looking at this, knowing the TGA that you worked with years ago.
Yeah, it's changed.
Not tested, not tested.
I don't recognize them.
And I'll go to the last one, which is half and half, LD8974. LD8974. This is their own website. Not tested. Oh, it did pass on purity. It passed on identity and it passed on endotoxin, but it didn't pass on composition and strength result.
Wasn't
and
tested.
Yet, yeah. And they're saying in their report, if we go to their summary report, that they were all tested. They were all tested, but they weren't. Let's go to the summary executive report. We've done our review and we're ensuring the quality and safety of vaccines because we tested them. Well, you didn't. We found, and they just gave us 28 out of 440, and they didn't give us the worst one because we know, yeah, that is a mantra because people were scared of COVID. We should have been scared of the government.
And it depends on how they were tested as well. If they're taking advice from the manufacturer, that's a problem. I'm very suspicious.
Well, you've got lots of good reason to be suspicious. We're going to have to wrap this up.
Yep.
Sharon,
sorry, it's gone a bit long.
No, look, this data, you've done so much work. It deserves to be brought to the public's attention. And so, look, for those people who are out there saying, you know, what are you guys still waxing on about this for? Because it's, you know, let's just move on. Philip Altman, how can we move on?
Well, we have to spread the word, and you and Johnny are doing that, and it's important. And I feel we're getting there. The more and more I speak with people, the more I am convinced that people are are awake now. A lot of people are awake. There's still a lot that aren't, that don't want to listen, that think we should just move on. But we have to keep spreading the word. And that's why Sharon keeps doing what she's doing. I keep doing what I'm doing, and many others have to spread the word, because if we don't, this sort of thing is going to happen again. And the damage that's continuing. I mean, we're not through this. The cancers, the heart conditions, and so forth, that are continuing now at levels that we've never seen before, that are unexplained by the Department of Health and the TGA. This is continuing. The damage is enormous. When they say that 100,000 people have been reported to the TGA under the DAEN system, you can believe that it's probably closer to 50,000 to 100,000 deaths. That's just the deaths. That's not the people with cancer or with heart conditions now. So this is really serious. This is really, really serious.
Like, I had an email this week from a doctor saying, can you please look at the batch numbers of a case of a death and the death happened a while ago. So people are picking up, did I get a bad batch? And some of them, it wasn't a case of the bad batch, it was the components in the product. And you can look up the TGA for product information, and you can see the chemicals listed. They're listed because it's a requirement. Under the TGA, they have to have a product information document, and each one is for the AstraZeneca, the Pfizer, the Moderna. They're all there, and you can see the chemical names. And if you have an allergy to that, you should never have been given that. You should have been given an exemption. And I've had cancer, and even though it wasn't tested for cancer or DNA toxicity, my own doctor said you don't have a contraindication. How many doctors were complicit?
That's a question that will be asked, hopefully in a Royal Commission, ladies and gentlemen, that needs to happen. Anthony Albanese, you made a promise, you've reneged on the promise, and we can only draw one conclusion from that you're part of the problem. So, look, with all of that, I think we should close this off with a prayer, and then final comment from you too, John. I know you dropped out there for a moment. Lord Father in heaven, we just thank you for the work of Sharon and Dr. Philip Altman. They've been relentless in drawing attention to these terrible situations that we're confronted with in health in Australia and indeed around the world. There has been a lot, there are a lot of things that people need to answer for, Lord. So please help us to find truth and to help that truth find the ears and the heart to serve that will make sure that these things never happen again. We ask this in Jesus' name. Amen.
Amen.
Final comment, Johnny?
Well, look, I just call upon the police across Australia, and particularly the police ministers, to take note of this information. There has to be police inquiries into this now. There has to be. I mean, this is murder on a scale that is just unprecedented, and it's not even been hidden now. So how they are not launching criminal investigations into this stuff on the background of the data and those that have died, and the amount of experts that are prepared to back that up is unbelievable. And I think that people like Yasmin Catley, the police minister in New South Wales, you need to act. There needs to be a task force set up in a state, doesn't matter where it is, as a precursor to a Royal Commission. This is just completely mad now. Put it to bed, and let's get the answers we need, and let's stop injuring people and killing them.
Well, we can't get remedy unless we investigate this and find out where the issues are. We desperately need remedy. The fact that people's lives are at risk because bureaucrats and other individuals are trying to cover their backside so they don't get into trouble, that's just reprehensible stuff. You can't turn a blind eye to that. So, Sharon Cousins, you're a real champ. You just do all this background work. It's been incredible. You know, I saw you at an event in Melbourne last year, I think it was, the ASF conference, and You're just relentless in your pursuit of honest data collection. We thank you for it. And Philip Altman, thank you for your expertise and your candor, because we know you're talking about, we're talking about institutions that you were involved in, that you had great respect for, and you had great confidence in. And the fact that you're speaking out, Philip, means a lot to all of us who are seeking truth. So we thank you for that too.
That's
Thanks for
right.
joining us, Sharon and Philip. And Johnny Larder, you've often been heard to say,
You just couldn't make this stuff up.
you couldn't make this stuff up. Stay out of the trees, everybody. Spread this around. It
Yes,
needs
please.
to be shared. If it's not now, Sharon will have all the links available to us, and we'll make sure that they're posted when this one goes out. And everybody, just be compassionate, be caring, but for goodness sake, speak up. God bless you all, and we'll see you next time on Club Grubbery. Bye for now.
Bye.